World Pneumonia Day is observed globally every year on the 12th of November to spread awareness and educate people to combat the disease. Pneumonia is the world's biggest infectious killer of adults and children, which is responsible for the majority of deaths of children below 5 around the world. On World Pneumonia Day, the main focus is on creating ample opportunity and encouraging global action, mainly in low and middle income countries, to fight the toll due to pneumonia and other respiratory infections. On this day, health organizations, together with ordinary people, try to educate, raise awareness, and promote advocacy that pneumonia is curable. We have public health physician Dr. Anire Chima Odoka joining us now to discuss further on the incident in Nigeria, among other issues. Many thanks for joining us, Doctor.
Thank you for having me.
All right, let's just get straight into it. Today is World Pneumonia Day. What is it really and how is it contracted?
Pneumonia is an infection of the lungs, the lower lungs, and it is usually caused by viruses, bacteria, and fungi. And it's usually contracted when by inhaling droplets of these organisms when an infected person coughs, sneezes, or maybe sings. So when someone that has the disease coughs, the bacteria or the virus is released into the air, and someone who's in close contact can inhale it, and it enters into their own lungs and causes the infection. So that is what pneumonia is.
Okay, why is it significant and what is its burden here, specifically in Nigeria?
Pneumonia is the single largest infectious cause of death in children under 5 years. In the year 2019, the World Health Organization said that over 740,000 children died from pneumonia. And most of these people are in South Asia and Africa. So it kills a lot of children. About 22% of deaths of children less than between 1 to 5 years old is caused by pneumonia. So it's the leading cause of death in children less than 5 years old. It doesn't also affect children. It can also affect old people whose immune system have been weakened over time. So it's really a significant disease that we need to tackle so that we enable our children to live long.
All right, today is World Pneumonia Day. I just want to understand what the significance for it is and what is the focus for this year precisely.
Okay, so World Pneumonia Day is a day where we put the spotlight on this disease in terms of educating people about pneumonia, advocating for more to be done, because the truth is pneumonia can be prevented. It is easily treated. It doesn't have to kill children, but a lot of people are not aware. So that is why the burden is still so high. So this year we are focusing on the theme for this year is every breath counts. Let's stop pneumonia in its tracks. So every breath counts, because we know as pneumonia affects the breathing. When you have pneumonia, it's hard to breathe. There's difficulty in breathing. So that's the theme of this year. Every breath counts. Let's stop pneumonia in its tracks.
All right. Are there any risk factors for pneumonia?
Oh, yes, there are. So like I mentioned earlier, it affects children less than 5 years old and older people. People with poor immune system, weak immune systems are more prone to pneumonia. So people with HIV, or they've had a cancer treatment or diabetes or anything that has lowered their immunity increases their risk. People that are malnourished, that is also tied to the immune problem. So we know that if you don't eat well, your immunity will be low. So you are more prone to being susceptible to the disease. Then also children who have not been vaccinated are at higher risk, who have not been taking vaccinations to protect themselves. People that stay in places where they cook with fossil fuels, so air pollution, cooking with firewood or dung, it causes pollution that can affect the lungs. And then people with chronic diseases like asthma or chronic obstructive pulmonary disease, Those are some of the people. And then smokers, of course. Smoking reduces how strong your lungs are. So those are some of the risk factors for pneumonia.
Okay, let's talk about prevention or management and treatment as it is now. Can pneumonia be prevented? And what about treatment? How does one go about it, really?
Okay, so like I said earlier, pneumonia is a disease that can be easily prevented and easily treated. You can prevent pneumonia by tackling the risk factors I talked about earlier. One of the ways we advocate for prevention of pneumonia is by ensuring that every child is fully immunized. Every child gets their vaccinations, because there are vaccines that specifically protect against the common bacteria that causes pneumonia. Talking about the pneumococcal vaccine, the Haemophilus type B vaccine, and then also getting all your vaccinations, the measles, the one against whooping cough. So ensuring that a child is fully immunized can prevent it. Ensuring that a child is well nourished. So for children, we encourage mothers to breastfeed exclusively for 6 months. Breastfeeding improves their nutrition, and so it makes them more resistant to the disease. And even if they do get it, because their immunity is strong, it doesn't last as long and able to bounce back faster. So those are some of the ways we can prevent. Then, of course, we advise people do not smoke. And even if you don't smoke, do not stay near people that smoke, because it can affect, it can predispose people to pneumonia. Do not cook with very unhealthy gases like firewood, dung. Use clean fuels to cook. And those are some of the ways I can think. Then for treatment, like you mentioned, it is very important that pneumonia is detected early. A lot of problem that comes with pneumonia that leads to death is that it is not detected early. So a child can have pneumonia and the parents do not even give the child the care that the child deserves. So, for example, it is important for people to be able to detect early when they have pneumonia. So, if a child is coughing for a long time, with or without fever, or complaining of difficulty in breathing, that is a pointer. So, a persistent cough that has lingered for a while is a pointer to pneumonia. You take the child quickly to a healthcare facility. Antibiotics, we don't even need very high antibiotics to combat pneumonia. So antibiotics are very effective against pneumonia if you treat early. And then, of course, if a child is having difficulty in breathing, giving oxygen as well can help.
All right, doctor, I know this year you've talked about the theme being every breath counts and stop pneumonia in its track, but is there anything you'd like government and policymakers to do on ward pneumonia? They're looking at the state of our public health care delivery and all of that. What would you like to see change, or what policies would you want to see change specifically as regards pneumonia?
Okay, I'd really want a lot of emphasis to be placed on immunization and vaccinations. Due to COVID, there are a lot of zero-dose children, a lot of children that have not gotten immunized. There's a lot of vaccine hesitancy, so we should work on making sure that every child is immunized. So that's one way we can tackle pneumonia. Also, ensuring that primary healthcare system works. So there's a primary healthcare center in almost every community. And so when a child has a infection or a disease or is ill, the parent can easily have access to a healthcare facility that can treat the child. So most times there's poor access to healthcare. So these are some of the ways the government put more money into healthcare. Primary healthcare system is the cornerstone of a country's healthcare system. So we need to put more emphasis on that and making sure every child is immunized. Tackling vaccine hesitancy, that can go a long way.
All right, thank you so much. We have been speaking with Dr. Annie Ray. We've been looking at pneumonia. Specifically, the theme for this is every breath counts, stop pneumonia in its track. Dr. Annie Ray Chima Odoka is a public health physician. Many thanks for all of the useful insights that you shared on the news tonight. We do appreciate them.
Thank you very much.
Hello. Hope you enjoyed the news. Please do subscribe to our YouTube channel and don't forget to hit the notification button so you get notified about fresh news updates.